Hi everyone, my name is Allison Lucchese. I'm a licensed marriage and family therapist, and for today's video, I'll be focusing on emetophobia, how to treat it, and how to manage it. To begin, emetophobia is an intense and irrational fear of vomiting, seeing vomit, or even the anticipation of feeling nauseous. So while everyone might feel uneasy about vomiting, those struggling with emetophobia experience a level of fear that significantly impacts their quality of life. So these fears can lead to obsessions that relate to contamination and rituals like excessively washing their hands, avoiding certain social interactions, or only eating foods that are considered safe. It's important to note that the anxiety and the fear is not just about the physical act of vomiting, but it's also about the fear of losing control, being embarrassed, or catching an illness that could lead to vomiting. So in short, emetophobia is a complex and multi-faced condition. So how do we go about treating and managing it? Cognitive behavioral therapy is one of the most effective treatments for emetophobia. By gradually exposing yourself to situations that trigger your anxiety, you can learn to manage your fear and reduce its power on you. Therapy for emetophobia is a process of curiosity, exploration, and adjustment. Because of its effectiveness in targeting and replacing detrimental thoughts and behaviors, we here at Embracing You Therapy highly recommend cognitive behavioral therapy to our patients who are seeking therapy for emetophobia. Mindfulness and relaxation techniques work well in tandem with cognitive behavioral therapy when it comes to recognizing unhelpful thoughts. Mindfulness teaches us to observe and accept that thoughts exist without judgment and let them go. When you practice this technique in everyday situations, it becomes easier to apply when the stakes are higher. Relaxation techniques that can slow your heart rate and steady your breathing can also help. It can help you starve off the feeling of anxiety that can be so reminiscent of nausea. Lastly, gradual exposure and desensitization are often combined with cognitive behavioral therapy. So this involves slowly and systematically facing your fears in a controlled and safe environment. Start with less frightening situations, such as talking about vomiting or watching videos that involve people feeling nauseous. As you become more comfortable with these scenarios, you can gradually increase the difficulty in exposures, which will eventually lead to confronting more challenging situations. The goal is to desensitize your nervous system to the fear, helping you build confidence and reduce the hold that emetophobia has on your life. So to start to wrap things up, finding a therapist that understands this complex and multi-faced condition is extremely important. And as always, if you have any additional questions or you would like to contact our office for a free consultation, you definitely can, and I would encourage you to do so. You can also visit our website at Embracing You Therapy for additional information.